Good evening, everyone. It's my pleasure to welcome you all to the webinar today on behalf of Team OT on 5th online webinar series to Professor Dr. D. Jagdishan for accepting the invitation and proceeding over the seminar on the topic Development of Adaptive Skills. I am sure that you all will be enriched with knowledge after completion of this presentation. I welcome you all to the webinar and hope you all have a great time. I would like to extend my heartfelt thanks to one and all participants. This webinar is to provide knowledge to all, give all the professionals delightful experience to impart wisdom to all the occupational therapy professionals as well as future occupational therapists. I thank all Team OT in charges for this continuous support. I take this opportunity to introduce our esteemed speaker, Professor Dr. T. Jagdishan sir, who has around 18 years experience in the field of occupational therapy. His educational qualification, sir is currently pursuing his PhD in Bharatdasan University. He has done his bachelor degree in Sandhurst College of Occupational Therapy. Dr. Jagdishan sir has done his master degree from Cambridge College of Occupational Therapy on mental health. He has done his fellowship in Advanced Occupational Therapy Program in Neurodevelopmental Disorder. Sir has done his certificate course in Cognitive Behavior Therapy. He has also done his Master of Diploma in Learning Disability. Sir has presented papers in various national and international conferences. His publications are as follows. He had published 20 research studies in indexed and non-indexed journals, professional affiliations. He has served as a convener for Tamil Nadu branch of IOTA in the year between 2010 to 12. Sir had been organizing secretary on National Conference of IOTA held in Chennai, OT ICON 2011. He was the organizing secretary of first state level inter-college sports and cultural meet among Tamil Nadu Occupational Therapy College in the year 2018. He also one of the member of Curriculum Development Committee in Tamil Nadu Dr. MGR Medical University, developed curriculum for BOT MOD degree course during the period of 2010 to 2014. Sir has developed the tool for learning disability parent rating scale in 2018. Sir is the life member of Indian Federation of Neurorehabilitation and Institute of Scholars. Jagdishan sir received Best Principal Award in the year 2020. Sir is the postgraduate examiner, Exam University of Specialty of Psychiatry. He also board of study member of Saita University and Magir University. He has experience as peer reviewer of Indian Journal of Oncology of Nursing, Indian Journal of Occupational Therapy, Indian Psychology, International Journal of Basic and Applied Sciences. He also one of the member of examiner panel for BOT MOT program, Dr. Tamil Nadu MGR Medical University, and various Dean University of Manipal, SRM University, Annamalai University, Rani Agaya University, Indore. Work experience. Sir is currently holding a post as a principal in JKM College of Occupational Therapy. Now I request Professor Dr. D. Jagdishan sir to take over the session. Before starting the session, I request all of you to mute your mic and maintain silence and professional decorum. Later on during the question session, time will be given to clarify your doubt. Now I hand over the session to you, sir.
Yes, my PowerPoint is visible.
Visible, sir.
Very good evening to all my dear friends. First of all, I would like to convey my special thanks to the team OT, the people initiating very good work in Tamil Nadu, organizing webinars, continuously working for upliftment of profession in Tamil Nadu. And also there are senior faculties also here. Very good evening to one and all. So today I'm going to share about adaptive skills. I'm going to give only overview because it is a big unit. I'm going to focus more on psychiatric aspect because the pediatric aspect is also there. Under that, you might be knowing many things. That is cognitive development and sensory integration developments are already is being conducted for webinars. So I'm going to focus more on adult oriented adaptive behaviors. So before starting the session, I would like to ask one thing. Are we have adaptive skills? We're all occupational therapists, so-called normal peoples. Are we have adaptive skills? Most of us can say, yes, we are having adaptive skills. That means we are able to eat, we are able to do our independent life. But the thing is, if you have anger, are you able to manage it? If you want to handle a group of 100 people or a group of 500 people, are you able to manage? If we think in that way, definitely everyone is lacking in that aspect. So we must know what are all the adaptive skills, what are the fundamentals we must know. Then only we can understand, yeah, it is very important. Because the adaptive skills are the core skill for everyone, not only for the patients, for normal human beings. We are all normal, but the thing is, we are lacking in some skills. We must understand why do we are lacking. For example, if you take an interpersonal relationship, all the people, those who are attending the webinars are not good in interpersonal relationship. Some of us are having splinter skills. That is, for example, I know different types of car. I know the mechanism, how the car is functioning, but I don't know driving. Will you accept it? Without knowing the driving, if I am talking about the functions of or the mechanism of car functions or different types of car, it's not accepted. So the skill must be entire thing. It's not only cover only the specific, right? We may think, I know everything. I know that, I know this, but that is not correct. Depends upon the situation, depends upon the environment, then we can identify ourselves. I can talk about languages. I know about some Hindi poems, Hindi Pandits, or the history, or whatever may be, but I don't know Hindi. Then what is the use of discussing about all that other facts related to Hindi? If I don't know Hindi, then everything is meaningless. So this is the way we are living our life. So in order to understand what is adaptive skill, we are going to start this session now. So this is a simple explanation. The skills needed to function and meet the demands of one's environment. Because the environment is always differs. I'm more comfortable in my family. When I come out of my family, I cannot manage. So do you call I'm normal? So definitely no, because in family I'm normal. If when I enter into college, I'm not able to handle the situation, then I called as abnormal. So definitely the environment decides. Okay, the second point is the skills necessary to effectively and independently take care of oneself, and two, interact with other people. That is also one more thing, because the basic term interaction is very simple term, but we need to understand what is the interaction process. Definitely we may not have. So environment is very important. Second one is, in every environment or all environment, I should produce my skills effective manner and also in independent manner. Both the things are different. For example, I am attending a meeting. I'm not able to follow the instruction given by the organizer or something. I'm depend on others. So my adaptive skills are weak. I'm attending mathematics class. I know simple concept, but I am depending on others, because whenever the professor is giving instructions or explaining some formula, I'm not able to cope up with that. I am depending on the nearby person. So I'm not good in that skill. So in that way, the adaptive skills to be explained. Okay, I am explaining because each and every words are very important. Skills needed to function and meet the demands of one's environment. I may know about football. I know the rules and regulation. Everything I know, but I don't know how to play football. So when you leave me in the ground to play the football, I do not know, because the football ground is deciding. All that knowing rules and regulations, different types of strikes, different types of functions, I know, but I don't know how to play the football. Then I don't have adaptive skills. That is the thing we must understand. Adaptive skills are the skills essential to function and meet the demands of one's environment. Here we are going to, as occupational therapist, we are going to discuss in the basis of functional skills. So we are working with self-care, we are working with communication, self-direction, social skills, leisure skills, home or school-based skills, functional academics, community use, work and health and safety. So these are all the adaptive skills. Every day we are working with our clients. So I have given this slide. It is very important because lot of researchers are needed in this area, because we peoples are doing more researches on handwriting, more researches on learning disability, more research on autism, social skills, something. But adaptive skills, different adaptive skills need to be analyzed, and different programs are adapted depends upon our patient. So more research is needed in this area. So we will try to do more researches in this area, right? Now we'll take the subcomponents of each one. Self-care. For example, if a child or a person with schizophrenia, they know how to do all self-care, eating, grooming, whatever they know, but perfection is not there. If you take a patient with schizophrenia, you are doing vocational training or whatever the skills are needed. You are placing a person in a particular job. For example, a server in a hotel. Now you think about this skill. We have trained everything. They are independent in self-care.
Sir. Sir, left right.
Sir, unmute பண்ணுங்க sir. Sir, unmute.
Yeah, sorry for the inconvenience. From my side, network is disconnected. I'm going with my section. Yeah, I have given the example. A schizophrenic patient is trained in a OT center or a rehabilitation center. Now he is placed in a hotel as a server. Now you think about all the skills. Self-care, because the place decides. Self-care is there, is able to do that. But for a hotel server, they need to wear a uniform.
Sir, excuse me, sir.
Yes.
Screen sharing.
Oh, it's not there. Yeah, wait.
Thank you.
I think it's shared now.
Yes, sir.
Yes, yes.
Yes. So the self-care, already the patient is independent, already trained, but in the hotel environment, he may not able to manage his self-care like dressing. Appropriate dressing decides the adaptive behavior. Appropriate oral facial hygiene decides whether the person is having good self-care or not. Right. Similarly, the communication skill. At a time, he has to manage 2 tables, at least 4 to 8 people at a time. So there, he need to decide which one is the first, which one to be served second, which one to be served third. It is based on self-direction. Right. So these are all the skills. These are all the skills decides whether the person is able to manage the environment effectively or not. All these skills are called adaptive skills. Every day we are crossing these type of individuals, not only the children. I'm talking about adult peoples. Immediately we are coming to the conclusion, this guy is struggling, so he might have mild mental retardation or something. It doesn't matter of diagnosis. It is a matter of skill, adaptive skills. So we need to work in all these aspects. Otherwise, they are not called normal. You take a same example for a person working in a teaching. Think about social skills. are leisure skills. You can imagine many peoples at a time about the social skill, right? You have all that examples or imagination in your mind. Whenever we discuss about the skills, then you can compare whether the peoples are having adequate skills or not, right? Because whenever we discuss about each skill, definitely some of the people will come in our mind and will get a good example. So in other way, we can classify these adaptive skills in three basic adaptive functioning. One is practical life skills, conceptual skills, and social skills. No, the practical life skills are ADL skill. We can say it is very basic ADL skill. ADL includes both the instrumental ADL and basic ADL. We know everyone is independent in basic ADL. But what about instrumental ADL? Definitely will struggle in somewhat. Managing small repair works in a home. Whatever we are using in a day-to-day life, that equipment or instrument is getting damaged or just interrupted. How we are managing definitely will depend on some other people. Only 20-30% of people able to solve that issue. Other remaining 60 to 70% of people will depend on others. How many of you know how to do fusing? When electricity is getting interrupted due to fuse in that particular box, switch box. How many of you are able to manage? It doesn't matter boy or girl or male or female. If we do not know, then we don't have adaptive functioning. Because we are all adults, we must know, or we must find out the solution for this problem. Yes, if everyone is okay, then no problem. If you are not okay, at least 20%, then we are weak in that adaptive functioning. That is the practical life skills related to instrumental activities of daily living. Conceptual skills: reading, calculations, money management, time management. We are able to manage. Take money management and time management. It can be explained in different terms, but you think within yourself, are you able to manage money and time? You can say yes, manage. Then why you are getting stress? Why you are getting anxiety? Why you are preoccupied with that money and time? If you ask the question, definitely we are not good in adaptive functioning related to conceptual skills. So we are all so-called normals. What about the patients? Patient with depression, patient with psychosis, patient with anxiety disorder. Definitely, we need to work with these people on practical life skills and conceptual skills. Then the social skills. Social skills include communication, understanding social rules and customs, obeying laws, detecting the motivation of others in order to avoid victimization. We are the last one, detecting the motivation of others in order to avoid victimization. Still we are practicing. We do not know the motivation or internal motive of other people. That is a social skill. We must judge. Now we recollect your past experience just before 10 years or 7 to 10 years. Definitely we may not have the skill. Every day we are learning. After 10 years also we will learn the skill. So social skills are important adaptive skills. If we don't have social skills, definitely we'll face mental health issues. So splinter skills, then now you have to understand it. Normal people's also having that. Splinter skills are the abilities that are disconnected from the usual context or the purpose. I have given the example. I don't know how to play football, but I know the rules and regulations. I know the peoples. I can give effective commentary, but I don't know how to play. So similarly, memory wise I'm good, but I don't know how. Where, for example, I need to travel to Chennai. I know the bus timings. But I don't know how to go to bus stop. Without knowing how to go to bus stop, then what is the use of knowing the bus timings, mug-upping the bus timings? No use. Similarly, the autistic peoples are having the tendency. More splinter skills are observed among autistic peoples. When you take a schizophrenic persons also, they are having skills, but practically they cannot know. They do not know how to proceed that. Verbally they can do it. So that type of skills to be observed and analyzed by the therapist, then we need to work. So in order to understand that, we must know different theoretical underpinnings, then we can work. So I'm going to take, in order to explain adaptive skills, I'm going to take only 2-3 theories in specific Moses adaptive skills. I think all of you know, or majority of you know about the Moses adaptive skills. Earlier it was 7 skills. Now it is 6 skills. That is sensory integrative skills, cognitive skills. After that, there was one more skill, drive object skill. Now it was not there. So dyadic interaction, group interaction, self identity, sexual identity, all the 6 skills are being processed. It is also there in the textbook now. And the theory of creativity. The theory of creativity also we need to correlate with these concepts. Because cognitive development cannot be explained. It is a continuous process and also sequential process. So we need to understand Moses theoretical underpinnings and creativity theories. With that background, we can go into the assumptions of adaptive skills. The acquisition of adaptive skills not only follows normal development. Theoretically, we know that each skills automatically developed in the sequential manner, like milestones. Physical milestones, everyone knows. Roll over, creeping, crawling, sitting, like it is automatically happens. It's a normal development. Similarly, the other skills also generally developed in a normal development. All the skills are believed that it has continuity in different stages of development. Continuity means, for example, what are the skills are learned in birth to 1 year? All the skills are essential to follow the stage 2, that is 1 to 2 year. It is a continuous development. If you miss anything from birth to 1 year, definitely it will affect the further development of the stage 2. Right? You understand that concept. Individual in a certain age group have appropriate behaviors belong to this age group. We'll take it, don't follow all these things. I'll explain very simply. For example, we can take a 10 people at the age of 10 years. 10 people with the age of 10 years. Can we expect everybody is same, or can we expect same outcome? Definitely not, because all 10 people may be equal in the age, but may not be equal in their skill or the performance. Why there is a lack? If there is a deprivation, in one stage, it affects the other stage performance or other stages growth. I used to give one example. I didn't attend first standard. I got double promotion from UKG to second standard. I didn't attend first standard. That is the only problem. Still I am having dyscalculia, because I don't know the basic mathematics. Right? Because basic numbers, symbols, I didn't learn. I do not know the ascending order and descending order. I didn't learn in that age. I can associate, but the proper learning was not there at my age of 5. So still I'm having problem. I can able to score centum in all the subject, but I scored only 40 mark or 40% of mark in mathematics because of that overlapping. This is a simple example. So the 10 peoples are there, 10 peoples are not equal. The deprived peoples are those who are lacking in their particular skills, might have the reason in any one of the stage. They might have skipped any skills. So that is the reason they are explaining. People might have functions. Yes, I can do. Even some of the skills are learned 1 year before. Some of the skills are learned after 1 year. But it doesn't mean, for example, a child is started uttering words at the age of 10 months. As per Indian norms, 1 year to, I mean 12 to 15 months is the normal range. They started to utter any words. Whereas the child is uttering at the age of 10 months, we can accept it. Or the same child or the other child may started to produce a word at the age of 1.5 years. That is also accepted. But it should complete the development. If there is a overlapping or if miss the sequential process, definitely there will be the limitation. It affects learning of the new skills in the next stage. So that is a core concept we must understand. The central idea of adaptive skills, it is stage specific learning. After a certain stage of learning is completed, it begins to enter the other stage. Stage one is finished, automatically we are entering to the second stage. Once first year finished, we are entering to second year. But unfortunately, my attendance was very poor. I got only 60% of attendance in first year. I missed basic anatomy and physiology classes. But I am promoted to second year. Anatomy and physiology knowledge is very essential for learning clinical orthopedics and neurology. The basic understanding of anatomy and physiology will definitely is going to help to learn the conditions. And also with the 60% of attendance, I may not be having adequate clinical skills. So definitely I'm not good in second year. I'll struggle in learning the contents which is going to be taught in second year. So it is a simple, because most of the students are there, you can understand. You're having only 50% of attendance, college is promoting to second year. Yes, you are in second year, you are equal with others. What about the learning? What about the skill? Definitely you cannot manage the second year subjects. Learning is a continuous process between stages. So it is continuous. When you skip second year, definitely you cannot learn the third year subjects very effectively. You will be in the class, but the skill wise, you will be poor. Or otherwise, you need to put more effort to learn that skill. Without learning that missed skill, you cannot be a complete practitioner in occupational therapy. I think everyone will agree with this. So now I am entering to Moses adaptive skills. So these are all the 6 skills we are going to explain: sensory integration skill, cognitive skill, dyadic interaction skills, group interaction, self identity, and sexual identity skills. So this is a simple definition of sensory integration skill. Sensory integration skills, the ability to receive, select, combine and use information from the vestibular, tactile, proprioceptive senses to perform functional activities. Here the Mose explains each stage by sub-skills. So as occupational therapists, we must learn the sub-skills. Then we can find out the exact reason for that. For example, here 5 sub-skills are listed under sensory integrative skill. The first skill is integration, ability to integrate tactile subsystem. This happens from birth to 3 months. Everyone might be having the experience of handling a newborn. Just to imagine from birth to 3 months, what is happening there? The child is having innate skills. Innate. Inherited skills. The child will do only sucking. Sucking is the inherited skill. The location of the stimulus is perceived by a tactile system. If the child doesn't aware of the tactile system, they have struggle in feeding. Just wait for 1 minute. I'll add my charger and come back.
Wait.
Thank you. So in this stage, the child is able to tolerate stimulation related to touch. The child is able to perceive the tactile stimulation. This is a general process to be happen from birth to 3 months. Right? Because of that, the child is able to locate the feeding source. So with that innate quality, they started are getting pleasure of feeding. So this is one. So now with that, the child is now you understand the skills. What are the skills are taking place at this time? The light touch receptors are working. The child is able to accept tactile stimulation. The child is able to locate the point of tactile stimulation. The child is able to locate fairly, the term is very essential, right? When you read about rooting and sucking reflexes, only the things is the child is able to locate the tactile stimulus. It is very fairly. So because of that, the child is able to feed, the child is able to understand the hug, the child is able to differentiate the cold likewise. If it is not happens at this stage, what will happen? The child will feel discomfort. If tactile system is having problem, what are all the expected outcome? Definitely child will feel discomfort. That's why the child is crying. The child will show hypersensitivity to pain and cold. Hypersensitivity to pain and cold. The child will show unreasonable anger. So these are all the behavioral poor adaptive behavior exhibited due to problem in tactile subsystem. This is a simple example we can say. Normal adaptive process to be happen at the age of birth to 3 months. If it is not happen, automatically child shows this type of behavior. How this is being managed? Every stage has the intervention. How this is being managed? Everyone knows. There is a rough cloth. It is being rolled, wiped. Rough cloth means we are not using very smooth textures, no? When you deal with the baby, there is a special cloth. It looks like a little rough. Okay, so that type of cloths are used. That cloths are used to wipe the skin. That cloths are used to hold the baby in the initial stages. Later stages, the therapist should advise other tactile inputs if there is a problem. So these are all the very simple things what we are handling in tactile related issues birth to 3 months. Similarly, in the second stage, integration of reflexes. Once the reflex is integrated, the child will move to the next level of development. The reflex is not integrated, definitely they will not move on to stage. You can do overlapping. Without integrating ATNR, child will not move into the rolling over position. You can place a child in sitting position, but the problem is rollover cannot be possible without integrating ATNR. Simple example. So when you want to move to the next stage, first skill to be, or first the stage of first to be completed in a proper way. Without that, child will lack this things. Similarly, without integrating TLR or STNR, they cannot attain the next level of milestone. Right? So, in this basic, you can understand sensory integrative skills. Many things are there. So I have given some idea. With that, we can proceed further. So these are all the sub skills. Note down that maturation of writing and equilibrium reaction is 9 to 12 months. Integration of two sides of body 1 to 2 years. Plan fine motor movements 2 to 3 years. All these sub skills to be developed within the year, and everything is possible. Without fulfilling all this development, the child directly started walking. What will happen? Everyone knows, because all the therapists are practicing. Simple example, the child is missing crawling. Instead of allowing the child to crawl, we are making the child directly to walk with the help of walkers or something. What will happen? Most of the children are having hyperactivity issues, or when they are entering into the school, they might be having handwriting related issues, right? When you take a history shows overlapping of crawling. A simple example. So the adaptive skills are lacking because of overlapping of any one of these skills or any one of these stages, right? So adaptation becomes the problem. Next thing is cognitive skills, ability to perceive, represent, organize sensory information for thinking and problem solving. The sub skills of cognitive skills: using inherent behavioral patterns for environmental interaction, that is sucking. Whenever the nervous system is getting matured, automatically there will be some development that is discussed here. Next, the point 2, interrelating visual, manual, auditory and oral responses. So in this stage, every child is able to interrelate visual, manual, auditory and oral responses. It happens between 1 to 4 months. So the cognitive development, it takes place. I can give example because from birth to 1 month, always the child eyes is closed. They do not know, but later on, they are able to attend visual stimuli. They are able to interpret different types of handling, that is manual handling. They know the person who is taking care, mother's handling, grandmother's handling, some new other persons are taking, definitely they'll differentiate. Manual handling, they differentiate. Auditory and oral responses is there. It shows the cognitive skills. Next skill is ability to attend environmental consequences of action with interest. So they started manipulating the object. If you give a toy, through the sensory experiences, they understand some skills, because it is purely subjective what the child is understanding. It depends upon the toy, depends upon this outcome. We can measure, but we cannot say definitely it is happening, but it is happening. Purely subjective thing. Here the environment plays very important role in developing cognitive skills because the experience object, they started to act on the basis of egocentric causality. Four to 9 months, the child started to sit, even on the sitting and the crawling will happen. They manipulate the toy. They chew the toy. Sometimes they shake. They throw. Different manipulations, different actions gives learning. If this is not exposed in a proper way, we need to find out some problems. For example, I can say I can correlate with the creativity theories here. You can take a stage 2 incubation theory, because all the sensory informations are collected from birth to 1 year. After 1 year, with that information, I am trying to find association. If I take if I give a toy, the child is able to manipulate, they shake, they'll chew, they'll throw, they try to bend. All these explorations are there. With that, the child will understand, yes, I can do these things. So this is very soft, this is very hard, this is easily broken. All that cognitive skills are happening. So one more example I'll give here. So what is this? This is pen. Can you able to give 10 points with this pen? You need to give 10 points of answers. The pen is blue. Maybe you might be knowing the brand, but when you use your all 5 senses, because already you learned, when you think in that way, your tactile, proprioception, vision, when you taste or smell, you can write 5 points. That is very strong. The visual senses, it is 3-4 things is there. The color you can give. When you smell it, you can write 1 point. So all these things are happening because of your senses. Similarly, here in the stage of 9 to 12 months, the child is able to learn this concept through their senses, because already they are having the experience. So they learn, if I throw this toy, it won't break. I'm trying to take this toy, it is heavy. Right? Everything is a cognitive process. If you are not allowing the child to explore all the skills, definitely they will lack in skills. That is a simple explanation I can give, how the cognitive skills are essential during early life. The next stage, trial and error problem solving at the age of 12 to 18 months. Every skills are learned in trial and error based learning. Here, the ability to represent object in endoceptual manner. That is differentiating the components or the things through actions and thought, because they think whatever they are thinking cannot be executed with the toys. So they'll try. I am trying to insert this cap with this pen. If I am trying here, it is not possible. Then I am trying it, because I am thinking I can do this, but it is not possible. Then I do the alternate. So that is called a trial and error. So here, thought and actions are developing at the stage of 12 to 18 months. Then the next stage, that is example is object permanence. Taking diverse ideas, taking diverse ideas and influence on the play behavior. For example, everyone knows that what is object permanence. It is finding or trying to connect new things. For example, you give a toy, or when you show the toy in the right hand, after that you are changing that position. We used to play with the child, I think. So I'm having a cap here. So I'm playing with the child. Now it is in my right hand. I'm showing to the child. When the next time also I'm playing, the child try to open my right hand, because the child perceive that this thing will be here. That's why there is a orderliness in their things. If you give a shoe, they'll, after removal, they'll keep in that shoe the particular place. If you take a pencil, they try to keep in that place at the stage of 2 years. But all that misbehaviors are happens after schooling. But at the early ages, they try to keep the things in the place. So that is object permanence. It is very important development for cognitive skills. So the trying to do new connection is called object permanence. Then the next stage is represent the object in endoceptual manner, that is happening in between 2 to 5 years. Represent an object in denotative manner, that is 6 to 7 years. So here they started perceiving the viewpoint of others. So when there is a other control, that is apart from the family members, they'll be involved. That is they'll be in the school. There they started to accept others' concepts. So this is happening. Then the next one is connotative manner, the representing object in a connotative manner. That is the ability to use formal logic to work with the hypothetical manner. So here abstract concepts are trying to prove. Whatever they learn in the abstract, that is the concept is abstract, they try to find an answer for that. So these are all the developments are happening from birth to 13 years. It helps to develop good cognitive skills. If it is not developed in a proper way, or it is skipped, it leads to problem in advanced cognitive skills like problem solving, judgment, right? How the people, so there are different peoples. One is solving problem very effectively. The other one is not doing good, because they might be having problem in any one of the stage, or they might skip the stage. Okay. Next skill is dyadic interaction skills. So dyad means two. So with other one person, how they are making relationship. So that skills are dyadic interaction skill. Ability to participate in a variety of dyadic relationships, because when we are at the age of 1 year, we started to observe the others. Dyadic interaction is started. So we observe, then we'll participate, then we'll have a relationship. This is keep on continuing throughout the life. Dyadic interaction is a stage by stage development. Here the stages from 8 to 12 months, they are trusting family members. They're trusting family members. That means they must have the confidence towards the family members, right? That relationship is very essential. The trust to be developed with the family members, that is the primary caretakers. It is very essential. For example, if it is not happening, what will happen? There is no trust with the family members. So they'll be more preoccupied. The child will be preoccupied. Seeking need satisfaction in fantasy, that means they, without a meaning, they'll play. Either they'll simply manipulating the object without purposeful. Otherwise, they'll play isolatedly. And they show the marked dependency. If they doesn't have good family relationship, they'll be dependent. Then they will be showing the characteristic of suspiciousness. They'll not trust others. This is happens from 8 to 12 months. We must understand. It is a very essential thing. The family member or the primary caretaker should maintain good relationship. So in a practical situation, how will you maintain this trusting relationship? For example, the child is sleeping. Mother is adjacent with the child. That is, mother is taking care of the child. With that comfort, the child is sleeping. In between, the child started searching in between the time. At the time, the mother should be there. If mother is not there, started crying. This is one experiment. For example, if the situation is continuous, whenever the child wakes up, mother is not there, what will happen? There is no trust. The child will be preoccupied. So this is a simple example. While sleeping with the child, mother is always there. Whenever the child wakes up, within few seconds, mother should be there at the place. If mother is not there, trust will not be there. It leads to problem. So whatever mentioned in the problem, preoccupation, isolation, dependency, suspiciousness, everything is developed. Lack of these skills. Then the second thing is association relationship. It takes place between 3 to 5 years of age. This is a casual relationship. They do not know the meaningful thing. That is, at the age of 3 to 5 years, child entered into the school. They'll be having one good friend, right? It is association relationship. Simply sharing the things, other than nothing. Simply sharing the thing. Because we are going to discuss all this. But the relationship, the strength of relationship is always differs. Here, at the age of 3 to 5 years, association relationships takes place by sharing. This is easily disrupted. Today or this week, I can have one friend. Next week, I'll be having other friend. It doesn't matter. There is no strong relationship. Okay. It is minimally concerned with the need gratification. If the person is not there, then somebody will come into that place. I automatically started to play. So that type of relationship is there. So if it is good, the casual relationship will be there. The child is able to play simple competitive activities, and also they'll be more cooperative. If that is in a proper development. If it is not there, automatically the child shows the symptoms of withdrawal and lack of self-assertion. Okay. Then the next relationship is some relationship. It happens between 10 to 14 years. It is state of some authority relationship. That's, sorry, before that there is authority relationship. I'll explain authority, then we'll go to. So at the age of 5 to 7 years, child will be in the school. Child will learns that apart from parents, some other authority peoples also there. They'll control. They started obeying for that. But the child should feel parents are the primary authority. The other authority peoples, they're like teachers or other peoples, or it is relatively powerful. It is not powerful. They are not powerful. They are relatively powerful. That trust should be there. If some of the parents are saying that, no, you should follow, or if the parents are very submissive, teachers are highly dominating, what will happen? Automatically, there is a behavioral change. The normal development is the child knows that there is some authority. Apart from parents, other authority also there, we need to follow. But when compared with the parents, parents are dominative. The authority peoples are relatively in the power, but parents are in number one. This is a normal process to be happen. If it is abnormal, that the situations are authority peoples are more dominant, parents are submissive, what will happen? There are negative things may happen. Acceptance direction from acceptance of direction from an authority, and they'll start cooperate.
Dear participant, kindly wait for next staff. Explanation will be some disturbance. And, sorry for the inconvenience. morning, dear participant. Few minutes, sir will join. There is some network disturbance.
Sorry for the interruption. I'm continuing. So we are discussing about authority relationship. If it is a normal development, they'll accept the direction from the authority and cooperate. If it is negative, that means the authority they perceive that authorities are more dominant than the parents. It leads to over complaints. They refusal to accept direction from the parent side. They show the refusal. Whenever the parent says, no, you don't know anything, they'll not accept. And also, they show the fear. So these are all the negative consequences happens if there is a improper direct interaction skill between authority relationship with the child. Then the chum relationships. It is emotionally charged relationship. They'll be having one friend. That means they are very close at the age of 10 to 14 years. So they are more attached emotionally. They have mutual trust. They'll share the confidential information between them. They show minimal competitive interactions. They do not fight with them. So here the emotionally charged means I can say that. So they feel other person is very important. Extremely important to self. That type of relationship is there. So very close relationship will develop at the age of 10 to 14 years. If that is normal, if the relationship is good, then there are two important qualities will develop. That is, they perceive the need of others. They'll understand others' need and also they develop empathy. So empathy is a skill to be developed at the age of 10 to 14 years. Generally, it happens because of chum relationship. The next skill is peer and authority relationship. Here, they'll be with the other friends. They learn superior and subordinate relationship at the stage. That means he'll be the topper or he'll be the leader. I need to follow it. So the superior subordinate relationship will be there. If that is not developed, it may lead to interpersonal issues. If it is developed in a proper way, there is a development of realistic perception. That is reality perception of or reality perception towards authority relationship. The obedience, following the comments, following the rules and regulations, everything is developed at this stage. If it is not there, definitely it may create role confusion. It affects the interactions. It creates power issues. Then in the next stage, intimate relationship. So it generally happens at the age of adults. So the characteristics are mutually need satisfying, and when they involve with other one close person, they show the commitment. They accept the normal demands, and also they'll produce a normal demand with that companion, and they learn to sacrifice the thing. So these are all the skills are taking place at the age of 18 to 25. So I think most of the peoples are in this stage, so they might be knowing. So whatever the relationship they're having at this stage are mutually need satisfying. That is very important. Second one is it shows the commitment. Development of firm commitment is very essential at this stage. So there will be two person. If you take a 2%, both the person shows a demand, a little bit of demands. Everyone is accepting the demand, and also they show their own demands. So because of that, they learn the sacrifice. Sacrifice is on the part of self. So that is a concept they are learning at the stage of 18 to 25, intimate relationship. So if this is good, they'll be more comfortable in sharing. They'll be more comfortable in sharing of responsibility also. They'll be responsible. They experience the love. If that development is not there, then it becomes a question mark. There is a relationship problem and also power issues. Next stage is adolescent stage, that is 20 to 30 years. So nurturing relationship. They started to help others. That is the person who is dependent on them. If there is a husband and wife, husband is trying to nurture the wife, wife is trying to nurture the husband. That type of relationship takes place. So all these stages are focused on only on two people's dyadic interaction. It doesn't focus on group. It is dyadic. With the two-person relationships, these are all the skills are being developed. So it is very, very essential. Then I'll go with the other skills. Group interaction skill, the ability to engage in variety of primary groups. The groups are parallel group, project group, egocentric group, cooperative and mature groups. How the peoples are involving in group. At the age of 18 to 12 months, they used to play with only one close friend. That is parallel. Later on, when they involve at the age of, at the play school age or in the KG level, they have a few friends. They'll started sharing, because I'm giving only small examples. If time permits, we'll have one more session on this, because in the psychiatry, developmental group approach follows all the stages, right? It is very essential to read what are all the developments happening at this stage, each stage. It will take another 1 more hour. So I'm giving only brief idea. So project group is sharing of materials with the 4 or 5 members. Through that, the group interaction takes place. Then egocentric is 9 to 12 years. So here there is, when you compare with the dyadic interaction, you can find out the thing. There is a relationship, authority relationship is there, and some relationship is there. So with that, they have to manage the group. I am having one friend. He is also in that group. Now you think 9 to 10 members are there. I am more possessive towards my friend. I'll show my dominance. I'm expecting the others to accept my opinions and suggestions. Otherwise, I'll show my dominancy. That is egocentric. Everyone wants to listen my skills, observe my skills, appreciate my talents. All that expectations to be developed in this group. It is normal things. If it is not happening in the proper way, they show some psychosomatic symptoms. Then later on, or the simultaneously, the cooperative group is also there, because once they are understanding about the others' needs, what will happen? They'll try to manage, because the chum relationship is here. Individuals are able to observe others' skills, others' needs. They'll start to empathize others. So they'll be cooperative. So cooperative group is that stage. Then later on, when they become adolescent and adult, they started in the behaving in a matured way. Mature group also has some characteristics. So then 2 more skills: self-identity skills, ability to recognize one's own strength and weakness, and to perceive oneself as worthwhile and reliable and consistent and self-directed. So self-identity is also developed in the sequential way. It consists of 6 sub-skills. Ability to perceive the self as worthy person. So 9 to 12 months. Ability to assets and limitations of self. That is up to 1.5 years. 11 to 15 years. Perceive the self as directed. That is 20 to 25 years. Perceive the self as productive, contributing members of the social system. That is during the adult life. Perceive the self as having autonomous identity. That is happening at the age of 35 to 50 years. Then ability to perceive the aging process. So these are all the aging changes. Everyone should understand and accept it. So these type of skills are essential to develop the self, that is self-identity. The next one is sexual identity skill, ability to accept one's sexual nature as natural and pleasurable, and to participate in a long-term sexual relationship that considers the needs of both partners. Generally, it starts from the sub-skills start from the age of 4 to 5 years. Ability to accept and act on the basis of one's pregenital sexual nature. Accepting sexual maturation as a positive growth experience, that is at the age of puberty. Ability to give and receive sexual gratification at the age of 18 to 25 years. Ability to enter into sustained sexual relationship, 20 to 30 years. Accepting sex-related physiological changes as a natural process of aging process that is happening. That is at the stage of menopause, that is 40 to 60 years. Right? So all these skills, if they know, then they'll able to manage the sexual relationships and are able to manage their own identity. If they are not able to understand the basic concept of, or they are not able to understand, if you take example of this, any one of the self-identity, it is not developed, or is developed, but due to some pathology, it is interrupted. automatically they have identity crisis. Okay, then we have to train in all the skills, whatever they missed. So what are the role of occupational therapist in developing adaptive skills? It is very simple. The therapist often uses person environment interaction stimuli, and this stimulus must be in line with the abilities shown in the stage of development. So we have to place the person and arrange the proper environment to develop that skill. Therapist must provide an environment that facilitates growth of sub skills that need to be developed. Sub skills to be mastered in the order. Sub skills from different areas can be addressed at the same time. If they are normally acquired, first thing we need to identify, then it must be trained. If it is not there, it must be trained in a based on the chronological age. For example, this patient is lacking the skill, any one of the skill at the age of 4, then some skills are lacking at the age of 6. So we need to train the skill belongs to the age of 4, then we need to go for age of 6. Patient motivation and desire must be engaged, because already patients are having potential, that potentials to be channelized and identified. If that is properly channelized, then the motivation can be maintained or sustained. So these are all the basic principles the therapist must follow. So each and every stages what we discussed under Moses adaptive skills or have some of the activities also. So each stage explains the activities what we need to give to our patient. It depends upon the patient. For example, if you are dealing with a child, activities are different. If you deal with the adult patient with schizophrenia, activities are different. So this is an overview about adaptive skills. I have taken few components from Moses adaptive skills and few components from developmental frame of reference. So I hope this session somewhat useful to you. So with this information, I'm concluding my session. Thank you for sorry. Thank you, one and all.
Thank you, sir. Thank you for the wonderful session.
Thank you, sir.
Now, request the participant can clarify any doubts regarding this seminar. You can post your questions in the comments box also. For question and answer, so any doubts you can clarify. Sir,
Sir,
sir, I think it's a clear. Sir,
so if time permits, we'll have a session on developmental group approach later, sir, after some time.
yes,
Because due to my health issue, I cannot concentrate. I think I'm sure last 10-15 slides, I'm not able to concentrate fully. Time permits, we'll have one more session after some time.
sure, sir. Mohan, sir.
Yes, sir.
You can say vote of thanks, Mohan.
I thank all of the participants on behalf of Timothy, and I extend heartfelt thanks to our today's speaker, Professor Dr. D. Jagdish sir, who spared his valuable time for us to raise this program.